Let's talk about that deep, persistent muscle pain that has you questioning everything. What if it is a condition that even fools doctors? For so many, the symptoms of fibromyalgia and polymyalgia rheumatica looks dangerously alike, but their treatments are worlds apart. Both conditions can bring on body aches, deep stiffness, and a kind of fatigue that changes your life, making them incredibly hard to tell apart at first. This overlap often leads to a long, frustrating journey of misdiagnosis and second guessing. So let's talk about the distinctive features of fibromyalgia and polymyalgia rheumatica today. Fibromyalgia is a lifelong condition where the body's pain signals are amplified, and polymyalgia rheumatica is an inflammatory attack that needs a specific, urgent response. And getting the right diagnosis isn't just important, it is critical. If you're watching this, you probably know that it's like to be exhausted. It's not just the physical pain, but the emotional drain of feeling so unwell and having no clear answers. You describe your symptoms, the aching, the stiffness, the fog that clouds your thoughts, and maybe you've been met with skeptical looks. And perhaps you had basic tests come back normal and being told there is nothing wrong, leaving you feeling invalidated and alone. This experience is a tough reality for many living with chronic pain, especially when the symptoms are confusing or mimic other illnesses. The journey to a diagnosis for conditions like fibromyalgia and polymyalgia rheumatica or PMR is often full of self-doubt and medical dead ends. Doctors themselves can be perplexed, since both conditions share the common threads of muscle pain and fatigue, and the initial picture can be incredibly murky. The pain can be dismissed as stress, just part of getting older, or even all in your head. But that pain is real, both in fibromyalgia and in polymyalgia rheumatica. And the distinction between these two conditions is profound. Fibromyalgia is rooted in how the central nervous system processes pain, while polymyalgia rheumatica is an inflammatory disease. So, what exactly is fibromyalgia? It is a chronic condition best understood as a disorder of central sensitization. Imagine your central nervous system, the brain, spinal cord, has its volume knob turned all the way up. This means that your brain registers pain from signals that shouldn't ordinarily be painful. It's not a disease of inflammation in the muscles or joints, which is a critical point and we will come back to. The hallmark symptom of fibromyalgia is chronic, widespread pain. And when we say widespread, we mean it. According to current diagnostic criteria, the pain must be present in at least 4 out of 5 body regions and has to have been there for 3 months or more. This isn't just a sore shoulder or an achy knee. It is a persistent ache that can feel like it's in your muscles, ligaments, and tendons all over your body. You may have also heard of another diagnostic method involving 18 specific tender points on the body, but this is used less often now, and it doesn't quite capture the full picture of the illness. But fibromyalgia is so much more than just pain. It is a complex syndrome that often brings a whole collection of other debilitating symptoms. And one of the most common is profound fatigue, an exhaustion that does not get better with sleep. Many describe it as feeling like they have the flu all the time. Along with this often comes what's known as fibrofog, a type of cognitive problems that make it hard to concentrate, remember things, or think clearly. Other common symptoms of fibromyalgia include sleep problems, headaches or migraines, and irritable bowel syndrome, or IBS. The pain can come and go with intense periods known as flares that may last for days or weeks. And a crucial piece of the diagnostic puzzle is what doctors don't find. There are no definite lab tests or scans for fibromyalgia. Blood tests for inflammation, which we will discuss next, come back normal. Unless, of course, if the person has another condition in conjunction with fibromyalgia, like rheumatoid arthritis or lupus. Yes, that is possible. Fibromyalgia can be superimposed on other conditions, and this is why it is a complex pain condition. Now, let's switch gears to polymyalgia rheumatica, or PMR. While it can look like fibromyalgia with its muscle pain and stiffness, PMR is a completely different beast. PMR is an inflammatory autoimmune disease. This means the body's own immune system mistakenly attacks healthy tissues, especially targeting the lining of the joints and the tissues around them, which causes inflammation. It is strongly associated with Giant Cell Arteritis, a form of vasculitis. The most striking feature of PMR is the location and type of pain. Unlike the all-over pain of fibromyalgia, PMR pain is typically localized, symmetrical, meaning that it affects both sides of the body equally. It primarily strikes the large joints and muscles of the shoulders and hips. So think neck, shoulders, upper arms, hips, and thighs. Patients often describe as intense aching, stiffness in these specific areas. Another key difference is how the symptoms start and when they happen. PMR often has a rapid, almost abrupt onset, with symptoms developing over just a few days or weeks. A person may go to bed feeling fine and waking up feeling like they've aged decades overnight. The morning stiffness with PMR is especially severe, often lasting for an hour or more, making simple tasks like getting out of bed, brushing your hair, or getting dressed incredibly difficult. But as the day goes on, this stiffness and pain tend to get better with activity. Beyond the muscle and joint symptoms, PMR can also show up in general like flu-like symptoms, including a low-grade fever, fatigue, feeling unwell, loss of appetite, and unexplained weight loss. If you want to download a handout with the differences between fibromyalgia and polymyalgia rheumatica, go to my website. Become a member, it's free, and then you can download this and more than 50 other free handouts that I've posted over the years on my website. Now that we know the basics, let's put these two conditions side by side. Clue number one, the age factor. This is maybe the biggest clue right off the bat. PMR almost exclusively affects older adults. It's rare in people under 50, with the average age of onset being around 70 to 75 years old. So, if you are a younger adult, PMR is highly unlikely. Fibromyalgia, on the other hand, can show up at any age, but it is most commonly diagnosed in people between the ages of 20 and 50. Clue number two, the pain map. Think of your body as a map. Where is the pain located? With fibromyalgia, the pain is widespread and can be felt all over, in multiple quadrants of the body. PMR, however, is much more specific. The pain and stiffness are concentrated in the neck, shoulders, and hips, what doctors call the girdle areas. While someone with PMR might feel generally achy from inflammation, the defining severe pain in these specific areas are the main clue. Clue number 3, the morning experience. Both conditions can cause morning stiffness, but how it feels and how long it lasts are very different. In fibromyalgia, the stiffness is often generalized and can stick around all day. In PMR, the morning stiffness is profound and disabling, and typically lasting for more than 45 minutes and often for an hour or more. And the patients describe a feeling like locked in place. The key distinction, however, is that PMR stiffness usually eases a lot as the day goes on, whereas fibromyalgia pain and fatigue can be unpredictable and even get worse with activity. Clue number 4, the blood test. The bombshell. This is the most definite objective difference because PMR is an inflammatory disease. It leaves clear fingerprints in the blood. The 2 key tests, the erythrocyte sedimentation rate or ESR and the C-reactive protein or CRP, measure inflammation in the body. In nearly all cases of PMR, these inflammatory markers are significantly elevated. The ESR is often above 40 millimeters per hour. In stark contrast, fibromyalgia is non-inflammatory, which means blood tests for ESR and CRP will come back normal. If your blood tests show high levels of inflammation, it strongly points away from fibromyalgia and towards PMR. Clue number 5, the treatment test. The response to treatment is so distinct that it's sometimes used as a diagnostic clue itself. Polymyalgia Rheumatica responds incredibly well to low-dose corticosteroids like prednisone. The improvement is often rapid and dramatic, while patients feeling significantly better within just a few days. This is because the steroids powerfully shut down the inflammation causing the symptoms. Fibromyalgia, since it's not inflammatory, does not respond to steroids. Its treatment is a multi-pronged approach focusing on pain management, exercise, and lifestyle changes. A dramatic positive response to steroids is a powerful confirmation of a PMR diagnosis. Getting the diagnosis right isn't just about relief, it's about safety. About 15 to 20% of people with PMR also develops a related and much more serious condition called Giant Cell Arteritis, which is an inflammation of the arteries, especially those that supply blood to the head. And the symptoms can include new headaches, jaw pain when you chew, scalp tenderness, and vision problems. And if it isn't treated, giant cell arteritis can lead to permanent vision loss or a stroke. A quick and correct diagnosis of PMR allows doctors to monitor for and treat giant cell arteritis, preventing these devastating complications. This information is meant to empower you, not to replace a medical professional advice. If you are experiencing persistent, unexplained muscle pain and stiffness, it's absolutely essential to see a healthcare provider for a full evaluation. Try to keep a detailed journal of your symptoms, where it hurts, when it hurts, how long the stiffness lasts, and any other feeling like fatigue or fever. This will be invaluable information for your doctor. Please don't self-diagnose or start any treatment without medical guidance. Use this knowledge to ask informed questions and feel more confident talking to your doctor about the tests that you may need, like an ESR or CRP blood test. You deserve answers, validation, and a clear path towards managing your health effectively. And please remember, this video is intended for educational purposes only. And if there is an emergency, please call an ambulance or go to the nearest emergency department. Don't forget to leave your comments here. Tell me if you have questions about fibromyalgia that you would like me to answer on this YouTube channel. Thank you for watching. Goodbye.